Okay. Hello, everybody, and welcome to our Mountain Talks webinar for today. My name is Jennifer Cunningham. I'm the Assistant Vice President for Alumni Relations here at Lehigh, and I am here today with Dr. Judith Lasker, the N.E.H. Distinguished Professor of Sociology in the Department of Sociology and Anthropology in the College of Arts and Sciences. We're really lucky to have Dr. Lasker here today. One of the things we're trying to do with our Mountain Talks is be very timely. And we've been wanting to feature Dr. Lasker for a while now, but then unfortunately, these several hurricanes and disasters have cropped up, and we thought, well, let's do it now when it's really, we all need to hear what she has to say. So I'm grateful that all of you are taking time out today. We had over 100 registrations. Generally, we see about 20 to 30 people in real time, and then a bunch of people download our talks later. So if you have to drop off early or you know people who wanted to see it, we will be sending out a link after we are finished. So how this works is Dr. Lasker will just give us a quick synopsis of what she does and her book. And then I do have some prepared questions, but these actually work much better when you ask the questions yourselves, because then you get to hear what you really care about. So to ask your questions, there is a chat box at the bottom of your screen. Just type in your question and I will read them aloud to Dr. Lasker and interject other questions and commentary as we go along. All right, well, let's get started. Dr. Lasker, why don't you tell us about your research and your life's work, and in 3 to 5 minutes.
My life's work. Well, my life's work is in medical sociology, which is a subfield of sociology, and I've been interested in a lot of different aspects of that, including women's health issues and chronic illness and grief. But all the way through, from the beginning of my career, I've been very interested in global health issues. And I did my dissertation in Cote d'Ivoire in West Africa on healthcare, and I've taught global health as a course here for a number of years. It's become more and more popular as the field of global health has become very popular. And I got interested in the topic of the book that we'll talk about, Hoping to Help, because of Lehigh. For two things. One is that I had many students who were going on short-term volunteer trips and saying how fantastic an experience it was, but wondering if they had done any good. Was it only about their own benefit? So students brought this question to me. And then the advancement office connected me through Matt Matern, who works here, to Becton Dickinson, that sends their own employees on short-term trips, and they wanted Lehigh students to go with them. So I worked with a couple of Lehigh students, 3 actually, who went on 3 different trips, and helped BD with some research. One of those former students is now a faculty member at Lehigh, Syria Lang, which is fantastic. So those experiences really got me interested in posing the question, well, this is increasing in interest, this huge demand for programs coming from churches, from universities, from companies, from NGOs. It's just mushrooming and has been for the last 20 years or so. And there's been a lot of praise for what people do, and there's been a lot of criticism. But as a sociologist, I was interested in, well, what's the evidence? What do we know about the value of these programs? Has anybody actually gone and followed up to see whether things changed and in what ways? And so that's where I started, was trying to look at the evidence, and I discovered that there's actually very little. There's a lot of anecdotal evidence, but very little good scientific evidence.
For the short term or the long term?
For any kind of outcomes, really. There's just not. So I started looking at the whole phenomenon of short-term volunteer trips in global health particularly. There's volunteers doing lots of other things, but I was mostly, because of my medical sociology background, interested in health. And I surveyed hundreds and hundreds of organizations that send volunteers to see how they do it, what do they do, what are their common practices. then I went on a couple of trips and I interviewed or had assistants interview people in the host countries who work with volunteers, asking what they saw as the value. And in every case, no matter who I was talking to, I said, so how do you know if they really help? And more often than not, it was like, well, we assume it helps, or we think it helps, or we see examples of that it's helped. Or, they like us and smile and tell us to come back. So that's great. But at the same time, we've seen these critiques that a lot of these trips are expensive. There's billions of dollars being spent on these short-term trips. And most of the money goes to the airlines or goes to American suppliers. Very little goes to the host countries. And in many cases, people interfere with host country health systems. They compete with local doctors. We've seen a lot of examples of Americans with no training doing medical care, which is completely unethical and illegal. It would get you arrested in this country. And yet people, you see these undergraduates trying to deliver babies because isn't that cool? Well, yeah, it's so that's kind of the worst of it. But even the really skilled people who go on short-term, let's say, surgical trips, there's not always a follow-up to know if there's been complications. So there's a lot of potential harm being done, and many people in the university world, the medical school world, are seriously objecting to this. And then you have people in, journalism and so forth raising questions about, is this a white savior complex? Is this just, a bunch of rich people thinking they have all the answers for poor people and that they're going to save them by going for a week and, doing some things. And, I try not to sound as cynical as I am sounding because I know that people who do this are really good-hearted and well-motivated. Now, there are some who do it because it's cool and looks good on a resume and, for much more personal advancement reasons. But mostly people want to be helpful. So really what I ended up doing was looking at, what are the common practices? How do they compare to what people in the host countries say they actually want and need? And then identifying criteria for what looks like would be much better practices. So I'm not one of those people who thinks, it should never happen. I think there are some good programs and there are some good outcomes. But I think there's a huge amount of money being spent that mostly doesn't help the people it's intended to help because of all kinds of other motivations going on. A lot of this is a profit enterprise. There are people making money, and the more students and the more individuals without skills they can recruit, the more money they make. So there's a lot of issues that need to be addressed. So the good news is that a lot of people now are addressing these issues. And I've been working, since the book came out, I've been working closely with people in the faith-based sector, people in the university sector, corporate sector, NGOs, to publicize the best principles for good practices in short-term volunteering and see what we can do to help groups that are really trying to make it better. And there are many people trying to say, let's do it well, and let's do it respectfully and ethically and legally and effectively.
Right.
So that's where I am right now.
That's where you are. Wow. So we have 21 people on so far. So again, if you would like to ask a question, there's a chat box in the lower part of your screen here. Just type in your question and I will read those aloud. Just the term that we've heard, voluntourism, is that a good word?
I don't use that term because I think of voluntourism in a much more narrow way. There are tourist companies that add in an afternoon of service or a few days of service as part of their tourism package. Cruise lines and other groups that are fostering ecotourism, go stay in this beautiful, eco lodge in the jungles of Costa Rica, and yeah, you can also go count turtles or something.
Right.
But it's really about tourism. Most people who go on volunteer trips are not really tourists. They may include some tourism, which is good for the country's economy. I actually endorse that. But the focus is really on the activities.
Right.
So I tend to just call it volunteering.
Okay.
Yeah. There are a lot of names for it. Some people call it short-term medical missions, or short-term experiences in global health. There's a variety of terms. I don't like
Voluntourism.
Yeah.
So Martha Farley from Wired Connect has a question. Where is the best place to donate money after a natural disaster, domestically and globally?
So that's a great question, and that's really why I was invited to talk today, because I published a piece last week in Salon.com, which linked my findings from the book and the research I've done on volunteering generally to similar issues that come up with disaster relief. So I actually gave, there are some sources that are available to you. I think there are a couple of things that are really important. One is that there's just been a lot of experience, both in disaster relief and in health, global health generally, of people donating things that they can't use, that the donors can't use or don't need or are expired or whatever, that they think, well, somebody must need these, right? And so the result is that in Haiti after the earthquake and in Mississippi and New Orleans after Katrina, there was tons of stuff that people had given. And after the tsunami, beaches filled with winter clothes and stuff that people just didn't need. And in Haiti, the airport overrun with pallets filled with high-heeled shoes and all kinds of stuff that people thought, oh, okay, they need stuff, let me send it. And they're not thinking very carefully about what's needed.
So is there is it the Salvation Army or the Goodwill or somebody who's organizing this and should be saying, we're not taking any winter coats?
Thousands of groups that organize this. And it's all, like I said, very well-meaning. You may have a group at Lehigh. This happened actually not long ago. There was a disaster in Haiti. I think it was in Haiti. And a group of Lehigh students said, let's collect a lot of, cosmetics and toiletries, toiletries mainly, and, toothpaste and so forth, and we will ship it to Haiti. And I'm sure there were ways they could be used and that people could use them. They weren't shipping winter coats and high-heeled shoes, which really are inappropriate. But there are two problems with that, at least two. Shipping stuff has, even if it's stuff that people can use, can actually compete with the local economy and hurt local business people. Now, the current situation in Puerto Rico is such that there's such devastation that it's hard to argue, don't send stuff because they have it, other people have it there. And I don't know enough about, what's the state of the shops there. But in many cases, there are local folks who have the equipment and supplies that are being sent from overseas, and their ability to make a living is undermined by the good intentions of outsiders. The other thing is that, if I go out and buy a bunch of diapers and toilet paper and toiletries and so forth at full price here, and then I give it to some group that's going to pay to ship it, it's expensive.
Right.
And we don't know if it'll get distributed to where it's needed. So most of the people who write about donations, so I'm getting back to the question, strongly encourage sending money and not materials, unless a particular local group says we need it. But it should come from a local group. It should come from a group in Puerto Rico or in Texas or in the Virgin Islands, whatever, saying we really could use this. We don't have it available locally. And then even so, I would go through an organization that's established, that has a disaster relief procedure, and has for example, there's one group, and I don't want to endorse particular groups, but there's one group I support because they get all of their materials shipped for free. They're organized in that way. They have a relationship with FedEx, which actually does the shipping. They know where it needs to go and what needs to be shipped. So I very strongly suggest that people do help out because the needs are enormous, and not just in Puerto Rico and Texas, which have at least some American government support, even if inadequate, but in some of the other islands where we don't even hear about them anymore, but they're equally devastating. Look for disaster relief organizations in the U.S. that have a track record of working in disasters. And then the other thing is that many of us have contacts, and we see recommendations of local organizations, based in Puerto Rico or based in some of the other islands, who are able to identify the needs and then give them out. And so it's the same issue with the sort of more general volunteering under sort of more normal times, is that we too often go to places or send things to places assuming what they need and not really knowing from the community's point of view what actually do they need and how can they use it best. My favorite example that I wrote about in that Salon piece was a colleague who worked in Mississippi after the Katrina hurricane. Somebody sent bowling balls and bowling pins. And it turned out, so I just found this out, the relief workers actually set up a bowling alley in one of their hangars at the airport. So they had fun with it, but it was a very bizarre choice to send to a Mississippi after a disaster. So I hope that answers the question. I think there's much to be done. I would look at the references that have been posted for you. The article from FEMA actually is quite useful. Charity Navigator is a great source for understanding financial aspects of any charity that you're interested in. And again, there's some other sources that I think are useful, but do some research. Just because somebody says they're going to be helpful doesn't mean they will.
Mark M. is saying that he's been involved with Save the Children for many years, who does a huge amount of work with emergency response in Houston, Puerto Rico, Nepal, currently helping with relief efforts.
Great.
So Al Williams has a question, and maybe you answered this in one way. Generally, if I'm deciding between donating time or money, is one usually a better answer? And I would also add on to that, in terms of time, are there things we can be doing here in the U.S. that aren't necessarily on the ground delivering babies, but are there other ways we can volunteer?
Okay, so you're talking for disaster relief?
He didn't specify, but
is this a broad question about volunteering? And
I would say let's stick to the disaster relief, since it is kind of the hot topic. So if I wanted to help Puerto Rico and I don't have money to give, and I'm not going to go down there and help, how can I be donating
and going
time and talent
to Puerto Rico to help, unless you've got some good skills and good contacts? I mean, part of the problem, as with the equipment, showing up and then getting in the way, and needing to be dealt with, needing energy to sort of figure out how to get rid of it.
Volunteer management is hard.
Yes, so people showing up, unless they're part of an organized group, is also not a good idea. But if you can find a group, if you have skills, and I just read this morning that there were some messages coming out of Mexico after the earthquake that they don't need medical services. They've got good medical services in place, but they need people to help with construction, materials for construction. So I would, suggest people look into that, depending on their skills. In a lot of cases, just going to an organization that is involved with providing services and offering time to help them on this end is extremely valuable, because some of these organizations are now flooded with people wanting to help, and somebody's got to be answering the phones and processing the messages, and that's really helpful.
So volunteering for the organizations that are helping.
Yes. And, there are a lot of people from the islands who live in this area and live all over the U.S. who are, in a terrible place, worrying desperately about their families and, who may need help just if they're getting family members coming to help them resettle. I would talk with some refugee agencies. I mean, disaster is never just a short-term issue, right? This is not going to go away. There are people around the world who are affected by disasters, whether they be wars, earthquakes, and so, the fact that we have many refugees without a place to live and needing help, there's a lot that people can do locally. And then, of course, there are many causes and many problems on the U.S. side that, on the continent, that need addressing. So there are many opportunities for volunteers to work. I think the most important thing is to always be sure you're doing what communities need and not what somebody else thinks they need. That's really key.
Right. Okay, so Sally Bond.
Hello, Sally.
From the class of 82. Hi, Judy. Thanks for sharing. My ELCA Lutheran Church in Chapel Hill has an active campus ministry with a strong service component. It's very likely they'll consider spending spring break in Texas, Florida, or Puerto Rico, as they did in LA and Mississippi after Katrina. I will certainly share your book with them. What kinds of best practices do you recommend for short-term service trips? So if they are going to take one of these short-term service trips, are there best practices?
I would just, first of all, be sure that this is the best strategy, right? A lot of short-term, okay, so let me put it this way. When I interviewed people about short-term volunteers, one of the things I asked was how long should they stay? And basically, the answer I got from 4 different countries on, 3 continents, 2 continents, was 3 weeks. Now, most trips are a week, right? So you spend the first couple of days getting there, getting oriented, figuring out where you are, recovering from whatever jet lag, right? And then you have a few days to do something. And oftentimes you're in a place you've never been before and you've got to learn what you're supposed to do. And then you go home, right? So I think it's important to think hard about best use of time. Maybe fewer people, but for a longer period of time so they can actually get to know the place a little bit, meet people, know a little bit of language, and be able to have a more lasting, because otherwise, honestly, and I'm sorry, Sally, to unfortunately, there's just so many groups that go for a week. And the real beneficiary are the airlines. And we're contributing a lot to global warming by having a lot of people flying back and forth to poor countries. And the amount of money that we're spending to get there could be spent by those countries. And in a lot of cases, what people are doing are jobs that local people could be paid to do. Right. So I'm not saying that, people should all just stay home and send checks. Although in some cases that would be best. But I think you have to think carefully about what's the value. And a lot of times host communities feel like they sort of put up with volunteers because they want to be hospitable. It's part of our culture to be hospitable to people. But there's a lot of stories about, groups that go to the same place and, paint the same wall over and over again. And so it's got to be really clearly defined what can be accomplished during the time that they're there. And that's hard because people do want to go and they want the experience and they want the hands-on and they want the connection. I completely understand that. But it needs to be planned carefully so that it is really meeting the needs of the community in the best possible way.
Cheryl Shire, class of 91, says, are you aware of opportunities for people to volunteer to help prevent severe impacts of weather events? For example, building up dunes, improving construction in vulnerable coastal areas, helping families create disaster emergency kits, etc. That's a great question.
Yeah, it is an important question. When I chose to just focus on health-related volunteering, I knew that one of the other really big areas is environmental projects. So it's not something that I know well. And even in the health area, honestly, I'm very reluctant to recommend a particular group because they change all the time and, different people have different things to offer. I would do some research. There's a lot of websites for people looking to volunteer. And then be very cautious because some of those websites are just promoting their own profit-making program. So you want to look carefully at volunteering websites. There's some Facebook groups that look at different volunteering opportunities. And then ask hard questions. And that's really what I've been trying to do, is to get people to, I actually have an appendix in the book, which is questions to ask, things to consider before picking an organization to go with. Because you want to be sure that it's an ethical, responsible organization that has worked with the same community over a period of time. They're not just parachuting people in and saying, go over there and fill sandbags or whatever. Because the work is really important, and so I would say you should look at environmental volunteering resources, and there are some people here on campus that if you want to email me directly, I can put you in touch with who are more knowledgeable about the environmental piece of this than I am. Okay. So yeah, anybody who's out there wants to just send me an email. It's judith.lasker@lehigh.edu. So write to me.
Yes. Sally says, very helpful, thank you. All makes sense to me.
Sally, write to me. I want to know how you're doing.
It sounds like she may need to turn around and talk to the people she was mentioning. So maybe it could be helpful there. So Scott Clark says, I've volunteered my medical services for 10 days at a time at a hospital in Guatemala for the last several years. The faith-based mission that serves this hospital has a program that staffs the hospital for about 45 weeks a year, gives the program a fairly good level of medical continuity for the few patients who need prolonged care. Charity Navigator has highly rated this mission for many years. I just recently saw and purchased your book because the title states a question I've always had. Do you have any suggestions for an individual to discern whether I am actually helping?
That's a great question. Yeah. So first thing is the fact that this continuity is really important. So many of these trips, and this is the disaster relief as well, they go for a very short period of time and then they're gone. So a lot of people are concerned about the future of places like Puerto Rico, where there will be tens of thousands of folks there for the next few weeks, and then they're going to go home. And the needs, and this is true if you go back to New Orleans today, how many years after Katrina, or to Haiti after the earthquake, a lot has been done, but there's so much more. So continuity in the same place over a period of time is a really big plus. That suggests that they actually have patient records and follow people up. They're not, I can tell you horror stories of students showing up in places where there's no regular care, and the clinic was created for them, and they're handing out medications that people will never be able to follow up on. It's just, so compared to that, what you're describing sounds much more reasonable. Yeah. I presume you actually speak some Spanish, which is a big plus. And then how do you find out? Well, it's very tough. Evaluation is really tough, but it still needs to be done. So programs need to take a look at how they're spending their money and how they're deploying their sources and saying, okay, what difference does this make? Let's look at communities that don't have these resources. Are they better off, worse off? Does it matter? Let's look at, time one before people come and see what the status is, and then does it change over time? These are basics of evaluation. And for many, many years, social and medical services have never done evaluation. They just assume if you see so many patients, you've done a good thing. If you handed out so many education pamphlets, you've done a good thing. Increasingly, funding agencies are now saying, you got to do more than that. It's not enough to see 100 patients. You've got to show that you've actually helped them.
Right. And I guess that would be really hard, especially when it's a disaster. You're a doctor, you see someone with a broken arm. Clearly setting that broken arm in that moment, or stopping that bleeding, or doing that CPR in that moment,
of course,
has helped.
Yes.
So short term, it seems like, okay, yeah, actually the number of patients, the number of lives I saved, but then what if that arm you know, if they don't have the right kind of brace, or like the long term of it seems
Right.
a lot harder
Yeah.
to measure.
So a lot of medical facilities were set up in Haiti after the earthquake.
Yeah.
And so I was in Haiti on a short-term trip a few years after the earthquake. And the two biggest problems, I shouldn't say the two biggest, but some of the biggest problems were, first of all, cholera that was brought by the UN. So that was a disaster created by the UN trying to help. And the clinics that I attended, when people were asked what's their biggest concern, their biggest complaint, it was acid reflux.
Huh?
Yeah, like what? I didn't learn about this in any of my studies of global health. Well, and I kept asking, well, why is this? Why is this? And nobody seemed to know why. I heard over and over and over again, I'm suffering from acid reflux. I kept asking people about this, and there are a lot of, potential answers, but some of it is that people don't have enough to eat. They get up at 3 a.m. to walk for miles to get to work. So they haven't really had anything more than coffee, right? They may not have more than coffee during the day. They get home late at night from a long day of work, eat one big meal, and lie down, in many cases after the earthquake, on the ground because people's homes were destroyed. So it's the living conditions that need to be addressed. So yes, it's wonderful. I mean, believe me, if I were in a disaster and I broke a limb, I would want somebody to come and fix it, and I would be very grateful for that.
But not a student.
No, definitely not a student. But but after that, then I heard about the the woman who had no medical training was doing circumcisions in Tanzania. Okay, so these are like crazy but they're not actually that
for everyone
unusual.
you hear about.
There's so I'm sorry, I've gotten off track with the question, but I think it's organizations that devote their time and money and energy to sending volunteers and ask for money to help support that. There's a lot of donations go into it. Universities help support students to go overseas. They need to be asking, okay, right. Not only, so sometimes what you hear is, well, it's good for the volunteer. It's good for them to see poverty, to do service. It will change their career, it will change their outlook on the world. Again, we don't have much evidence of that. Lots of anecdotes, individual stories, but again, we need more good evaluation.
Yeah.
That's where social science comes in.
Yes.
Very important.
Well, speaking of evaluation, it is time for us to say goodbye to Dr. Lasker. It's 12:03.
Everybody.
And we do, when you close out your window, you will see a survey about our webinar today. It would be really helpful if you could fill that out so that we can keep continuing to improve our programs here. Thank you all again for joining us, and thank you so much, Dr. Lasker, for sharing all of this with us.
And thank you for inviting me. I appreciate it very much.
Yeah, and we've put her email up here, judith.lasker@lehigh.edu, and she has invited you all to email her. I hope you will take advantage of that offer. Thank you again, and have a great week.
Bye.
Bye-bye.